Excellent. Well, welcome everyone on behalf of UICC and JPAGO. I will now hand over to our host and MC today, Dr. Sharon Kambabwe. Over to you, Sharon.
Thank you so much. A very warm welcome to everybody who's here. I think I should say good morning, good afternoon, good evening. Bonjour, bon après-midi, bonsoir, since we're coming from all over the world this afternoon. Afternoon for me. It is indeed my pleasure. My name, as Julie has mentioned, is Dr. Sharon Kambabwe. I am the Assistant Director in the Ministry of Health, Zambia, which is in Africa, Southern Central Africa. And it is an exciting time for us to have this dialogue today, which we're talking about cervical cancer elimination, a need for and a driver of health convergence. I first want to thank you, our hosts, UICC and JPAGO, for this wonderful meeting. And we're glad to inform you that this is the first in the series. We're going to have 3 series of dialogues where we're going to be having these important discussions. And all the contributions that are going to be coming in, whether through the charts, through questions, are going to help us as we build up for the World Leaders Summit, Cancer Summit. So make sure that if you have any comments, that you can please use the chat function and make your comments, and we are going to make sure that all these comments that you're going to give us are going to be collated. So what we're going to do right now is to look into the housekeeping rules. First, I'm sure all of us have been having these virtual meetings for over a year now consistently. Please make sure your mic is muted, your microphone is muted unless you're speaking. Make sure you can have your camera on if your connection allows. Some of our places, if you put on the camera, then you find that the connection starts failing. The chat box is open, as I have mentioned. Please make sure you make full use of it. Next slide, please. And a warm welcome also to our Francophone friends. Bienvenue, notre ami Francophone, this afternoon, evening, morning, wherever you're joining us from. And please choose your your preferred language. We have English, we have French translators as well. The next slide. This is our agenda for today. Like I have said, the topic of our dialogue today is cervical cancer elimination, a need for and a driver of health convergence. This is a very interactive virtual dialogue that we are having, and we encourage all that interaction to take place. To begin with, we're going to have a keynote speech, which will come from Dr. Nothemba Simelela from the WHO, and then we'll also a keynote also from Semesh, who's going to also speak to us from JPAGO. After that, we're going to go into a panel discussion. I will hand over the moderation to Wendy, panel 1. They're going to be talking about converging and catalyzing resources for integrated delivery of services and scale up, something that we need to start discussing. Panel 2 is going to talk about shaping the enabling environment. How do these partnerships come through? How are we going to be working as we talk about acceleration to cervical cancer elimination? Next slide. So as you were registering, we had put a poll and we had asked that you're filling that poll so that we can get an idea of who is in the meeting and their views. So we have 324 registrations have been done, 62 countries, which is amazing. Meaning we have quite a number of people to make very, very nice, this discussion, this dialogue, very, very interactive. Next, we had a pre-poll event as well. So as you can see, we had asked you to select the main role of your organization in the context of cervical cancer elimination. 63% are in the service implementation, and we had 32% are involved in advocacy, and we had the last percentage was people who are involved in funding. Next slide. Important to look at the funders who are fully informed about cervical cancer elimination. And we had totally agree with the 90, 70, 90 targets, or going up to totally disagree. So we can see that we have a range. We still have people who are disagreeing, a small minority, and about 40% agreeing. That shows that we still have a lot of work to go to make sure that we're all on the same page. Next slide. The next one, we asked about funders if they are fully supportive of integrating cervical cancer prevention, early detection, and treatment with other existing health services and infrastructure. From those 46 responses, we found that only about 30% totally agreed. Well, we didn't have anyone disagreeing, but that still shows that integration, having full support for integration, still needs to have a lot of discussions, and that's why the dialogue like we're having today is important. Next slide. Health programs that you are working on, we asked whether the health programs you are working on are open to and actually building integrated approach to cervical cancer prevention, early detection, treatment, and palliative care at all health services levels, from the community all the way to your highest level of service. And we find that only 28% totally agreed. And that shows, again, the need for dialogue, which has to go on. So to start this dialogue, gives me great pleasure to open. And the opening session, like we talked about, the keynote.
Yes.
It is my pleasure to introduce Dr. Princess Nothemba Simelela, who is the Assistant Director General for Strategic Programmatic Priorities, Cervical Cancer Elimination. And just to say a few words before Dr. Simelela comes in, is that in 2018, we had the Director General of the WHO, Dr. Tedros Ghebreyesus, come make a global call to action to eliminate cervical cancer. And of course, another milestone that we scored on the 17th of November last year, 2020, was the actual launch of the global strategy to accelerate the elimination of cancer of the cervix. So Nono is going to talk to us about the health convergence and how the WHO's approach overall aligns with this thinking on the route of universal health coverage. And indeed, having a holistic approach to health, and in the broader perspective, the Sustainable Development Goals, SDGs. And of course, we really want to know the thoughts of the WHO on how cervical cancer elimination fits in this agenda. Please allow me to introduce Dr. Nono Simelela to speak to us right now. Over to you.
Thank you very much, Sharon, and thank you to the organizers. I call them my friends and comrades in arms, Julie, UICC, JPIGO, our boots on the ground, and our research institutions, that inform the work that we do. I am going to try and respond to the poll by spending a little bit of time talking a little bit about the strategy before I then link it to this grand convergence that the Lancet has spoken about and many others, and then the report that has been prepared, as well as the link with the SDGs and universal health coverage. As Sharon mentioned, after the call for the elimination of cervical cancer was made, we set out to look and develop what I and all the colleagues and allies feel is probably the first, most comprehensive roadmap for the world to follow to deal with this potentially curable and certainly preventable cancer. So we really do believe that by looking at the continuum, right from prevention with an HPV vaccine for young girls to screening and treating women. 70% of women screened with a high performance test, and those found to have an early lesion treated appropriately and on time. And then 90% of those who unfortunately have advanced cancer receiving the most comprehensive care, including palliative care. I think this was the first time that we were able to put this irrefutable argument in front of heads of states and our member states in WHO to say this is doable. The argument that we put firstly was to do very sophisticated work that done by the institutions, and I think Professor Karen will speak, Canfell, to the work they did to define what an elimination threshold would look like. These are stretch targets, and we make absolutely no apology to anybody, including the politicians, for having put such high and very ambitious targets, because this is a disease that really can be consigned to the history books if we really care about the well-being of women and young girls, and we even care about the well-being of society and economies, as it were. Here you have a cancer that the developed countries have almost eliminated, as it were. You know, countries like Australia are sitting at, incidence rates that are single digits. And yet in Africa, Southeast Asia, and many other Latin American countries, you've got so many women dying, 311,000 women, and 9 out of 10 of those dying, a woman dying every 2 minutes from this disease. It's unacceptable. And that is why, we feel very strongly that for the first time, we have put in front of the world a very clear roadmap. We have given countries something to strive towards, and we have also given ourselves as advocates, as researchers and others, a clear agenda for advocating for something. We are not just going around saying, oh, treat women or screen them. We know we're saying 70%, go and find these women and get them into the system. So I feel very strongly that this is a business for everybody. This is not where you can pick, and choose. And I often say cherry picking is a luxury of the rich. But even within the donor space, you can still have, a developing, an aid agency that says, well, we just want to focus on the vaccines. That's fine, because it's a big thing. And we have only reached 30% of the eligible population. But the message should then be that if you do that only, then help us advocate to get to the women who already have an infection, because there's a very clear link there that we make for communities and for societies at large. And mostly what we have done in this space of cervical cancer is that we have focused stop and starts around screen and treat. But the screen and treat, the treat was for pre-cervical cancer lesions. And we haven't put the spotlight on advanced cervical cancer, and women continue to die. So I'm really excited by the fact that, UICC, that's got such a broad range of stakeholders that focus on cancers largely, are helping us move this agenda along, because, and I've openly, called out our researchers to say, it doesn't stop at just looking at the cervix and deciding what genotyping test you want to do. It's also about making sure that that woman gets the full complement of treatment. So it's a compelling strategy. It's doable if we start now. If we postpone this, then all we're doing is just accumulating more and more death and more young girls being infected. And then we've lost the fight before we've even started. So where is the convergence here? with all the conversations that are going on around the SDGs, the health systems, even the new mantra of building back after COVID-19. All of these things converge around the fact that we're dealing with people, we're dealing with women. We're not just talking in the abstract. So if you want to really make whatever you do meaningful, you've got to look holistically at the people. Even if the person comes in, say I walk into a facility and I'm unlucky, I've got COVID, I still have many other illnesses that the system needs to respond to. Indeed, we have a pandemic, but we also have other diseases that will continue to kill people. So I really believe that by looking, our Sustainable Development Goals elaborate 17 things that the world should achieve. But we have shown, even within the strategy, that it touches on many of these goals. Gender equity, the well-being of adolescents, the right to education, all of the things that have to do with with SDG 3, it's around that. The right to full access to health services. These are all intertwined. I think we break them down in order for us as policymakers and advocates to get our heads around it. But they are all about what does government give to its citizens, women in particular, young girls in particular, that is holistic. So when people argue about this being, it's almost like a vertical program, I say no. Women also have breast cancer. They also have other cancers. And any investment you make in your health system to respond to cancers responds to many other things. You won't build a hospital just for cervical cancer. When you do that, when you strengthen your health system to provide services for cancer, you've got cervical cancer, breast cancer, uterine cancer, prostate cancer, everything, it's going to strengthen that holistically. So we may be the entry point or a catalytic program, as it were, but you're building capacity for everything exactly in that space. You are already responding, as I said earlier, to the SDGs. We've got to go back to how we articulate this ask to our ministries of finance and the heads of state. And we've gone past saying, this is a good investment, this is a good buy. We've got to find language and a narrative that is more compelling, And in one of my interventions earlier, I challenged the absence of men at the table when we discuss diseases that impact on women, but their overwhelming presence when policy decisions are made about where resources should go. So we've got to refine that language so that ministries understand that putting money into health is an investment. It's not a cost. And in this strategy, we've shown the return on investment, not just that, but comprehensively. When you look at the societal impact of dealing with this disease specifically, what you get in return. And it's very clear. We will also be working with our partners to do a country-by-country case study and investment cases to show the value really of keeping women alive and ensuring that at least of the myriad of diseases that are out there, this particular one is dealt with, it's appropriately managed, and it's comprehensively dealt with. And if we do that, we stand a big chance really to radically improve the lives of women. We know from the papers that have come out that, we want to see 4 things when you're dealing with this comprehensive approach to cancers. They continue to be the biggest killer of humanity in the world. You've got to have the investment. And we can't not confront the absence of this investment or the resistance to invest that we continue to see in many, many countries. And, I think it is also time for governments, especially in developing countries, to make that their issue, so we don't constantly look out or look up to the developed countries to say, help us do this. This is their business. These are their citizens. These are women and girls who are keeping the informal economy, if I can argue, alive, the formal economy alive, and societies intact. So they've got to look at that and say, how much are we really responding to this very, very pertinent disease? You need a roadmap. We've got a roadmap. For the very first time, we've got a roadmap that takes us to 2030 with very clear targets as to what governments should aim to achieve. You also then want to have data, intelligence. This is also a big, big gap. We don't have cancer registries in many of the countries. Our colleagues at IARC are consistently using models and surveys and all sorts of things. But if you don't know how many women are dying in your locality as a result of cervical cancer, then I call that a morally unacceptable thing to do as a leader, as a policymaker, as somebody who's got to respond to the rights of women. So we've got to help from the bottom up and also from the top down to get women and communities to be able to count. Colleagues on this call who are OBGYNs know that way back, we used to struggle to count maternal mortality. And we invested in what we've called community reviews, where you go out and you ask the community what killed the person. Was the person pregnant? So that we don't need sophisticated tools to be able to say or tell where women are dying and what they are dying from. And I often, as a last point, say the nature of cervical cancer is almost as if we are being granted an opportunity, because the way the cancer develops, it takes a long time, giving us time, 10 to 15 years in some cases before it truly then grabs.
Sorry to interject as we.
Oh, am I going over my time?
Listen to you. I know your passion.
My passion is going to drive everybody away. No,
I know your passion for this topic.
Yeah, you've got to stop me.
I can give you a minute to
okay. No, I was just saying we have enough time in the evolution of this disease to do something for women. If we catch that pre-cancer lesion, we have won. So I take your point, Sharon. When you start me with cervical cancer, I could go on and on forever, but I just hope I've touched the intersections, that you wanted as the hosts, and I stop here. Thank you.
Thank you so much. We can see your passion for this topic, passion for women oozing out as you speak to us. And I think the takeaway message that we're getting from Nono is that, cervical cancer, if we are going to be going as we are aiming for universal health coverage, as we are aiming to attend the SDGs, we must see elimination of cervical cancer as a facilitator of all these. It is a convergence. So we shouldn't see it as taking us away from those key things. So right now, I want to bring in, before I open the discussion, I want to invite Dr. Somesh Kumar, who is a Senior Director, Global Solution and Innovations at JPICO, to really provide to give us high-level thoughts from an advocate's perspective as we have this dialogue on cervical cancer elimination and need for and a driver of health convergence. Dr. Somesh Kumar, please, you may take over.
Thank you, Dr. Sharon, for the kind introduction, and Dr. Nuno for your very thoughtful and actually thought-provoking remarks. Honored to speak after such incredible leaders. So I'll try to make it very short to make up some time here. So I'm here to talk about a recent publication that hopefully will set up the stage for our conversation today. This publication was done by JPIGO in close collaboration with WHO, Gavi, UICC, IARC, and Together for Health. And this is on a framework for catalyzing action at all levels for moving towards the 2030 goals of 90% primary prevention, 70% secondary prevention, and 90% treatment rates. The paper, as you can see on the screen, is titled "Acting on the Call," and it will hopefully give you a framework for thinking through what kind of levers are required to be acted upon for mitigating the multi-dimensional challenges that has impeded access to primary prevention and secondary prevention services in the countries that we work in. Next slide, please. So again, this is the very simple framework. We call this the 5I framework, and this is to address the long-standing challenges, as I said, for impeding access to cervical cancer services. And we believe that this framework can act as a guide to rally efforts at national level and as the global level to facilitate rapid improvement in access. While our paper is focused on primary prevention services, we believe that the framework is applicable for both primary and secondary prevention, and actually for that matter, even treatment services as well. The 5 I's presented in the paper, as you can see here, correspond to innovation in products and service delivery, integration of services as the focus of today, information, as Dr. Nuno was talking about, as in data for decision making, and increased investments, as well as influencing the right stakeholders, including the civil society members, as well as the political leaders of the country, to catalyze action at all levels. Well, I'm not going to go into the details of all the domains. I will highlight some of these around which we will have the conversation today. As you will hear more in the upcoming panels, there is a growing recognition of the importance of provision of integrated services at the level of communities and facilities. So that, as I say, services are oriented towards the client and not the condition. And that's a very fundamental difference in how programs are sometimes designed based on how the funding is oriented or how the departments are oriented. So while this will need efforts at the policy and service delivery level within countries, it will also benefit from intentional and systematic coordination of and convergence of funding from the global level. We'll also touch upon leveraging of innovations in products and processes. I must bring out the significance of investments made by United in this area. And we believe that equitable access to these products, which include HPV tests, thermal ablation, and upcoming artificial intelligence-based tests, will go a long way in mitigating some of the long-standing challenges behind access. The link for this paper will be posted in the comment box, and I'm happy to answer any question on this on an email or subsequent conversation. Very excited to have this, to be a part of this conversation of super and very great leaders. I hand this over back to Dr. Sharon.
Thank you so much, Dr. Somesh, for that wonderful summary of the paper. And I think the paper has been provided for. We all know that one of the determining factors for all countries, especially some of us who are in the low income countries and even low to middle income countries like Zambia, is building strong collaborations with international donors, implementing partners. And I know, having been working for over a decade in cancer of the cervix, how difficult that is We initially had the government and, one implementer being funded by PEPFAR. And now we've moved to having a lot of partners. Collaboration is important, but coordination is also key to some of this. And you find every partner is coming in, they've got things that they're interested in. You also have things. So you need to have a coordination mechanism. And in this point, I want to introduce the first panel discussion, which is talking about converging and catalyzing resources for integrated delivery of services and scale up. And the moderator for this panel is Dr. Wendy Taylor, who is the Vice President for Technical Leadership and Innovation at JPIGO. I know that Wendy, you are very well placed to moderate this discussion. You have 2 decades of experience working within and outside of government, catalyzing innovations to tackle some of the world's toughest global health challenges and scaling up of market-based solutions for impact, which includes stints at the U.S. Agency for International Development, USAID. And at this point, I want to hand over to the moderator for this panel discussion, Dr. Wendy Taylor, please.
Well, thank you so much, Dr. Sharon, and it is such a pleasure to be here. And this is really an incredibly impressive group and such an important conversation and really important work that we're all tackling. So one thing maybe just to mention, the beginning is we have a project, our success project through Untitled. We're looking at introducing HPV testing and treatment of precancers with a view to working with countries to prepare services and cost them and to develop scale-up plans to achieve the 2030 targets that governments have set out to achieve. And so this is a really important part of our efforts. And one of the early pieces of work that we're doing in collaboration with The Economist will actually be shared as a white paper in February. And just to give you a sneak preview of the findings, because I think that's quite relevant to our conversation this morning, is that there is still a lot of siloed thinking globally from donors, locally from program implementers, and these may not be new insights, but they do show that we have a lot more work to do to be able to address this barrier to progress and really bring much more holistic thinking into our approaches. So with that, I think that sets the stage for this first panel, and it's my pleasure to introduce you to our speakers, and we're really asking each of them to respond to this larger challenge. So we have Dr. Matthew Barnhart, a Senior Medical and Scientific Officer from USAID's Bureau for Global Health, who is also an old colleague of mine, and very happy to see you, Matt. We have Nick Furtado, the Chief Health Emergency Medicine Relief and Development at the Global Fund to Fight AIDS, TB, and Malaria. We have to have Dr. Robert Matiru, Director of Programs at Unitaid. And we have Dr. Hayat Sindhi, the Chief Scientific Advisor and Vice President for the Islamic Development Bank. And so this is a great group. Hopefully everybody is, I don't even see all your faces here, but hopefully we will bring you up. Perfect. And so I'm going to ask you to all keep your answers somewhat short. We have a lot of ground to cover and a lot of questions to get through. And we also are going to bring in some comments from our audience here as well at the end. But so let me start with you, Matt. And there I see your face. Nice to see you. So USAID has been a long-term funder of cervical cancer prevention, and especially for those high-risk populations of women living with HIV. So can you give us a snapshot of what do you see as the impact of some of those early investments? And you've got some more recent awards in Malawi and Mozambique. So maybe tell us what you're learning, and has there been also a change in time over your thinking in terms of how you're shaping your country investments?
Thank you so much, Wendy, and thank you to all the organizers for, it's really a privilege to be here today to speak about such an important topic. And I think, one of the critical public health issues of our time and one of the most neglected. In terms of what USAID's been learning and our investments, actually within the last 2 to 3 years, there's been an increased focus on cervical cancer within the PEPFAR program, starting in 2018, May 2018, when the Go Further partnership was announced. And I'm not going to focus on that too much. I'm going to talk a little bit about the work in Malawi and Mozambique more, but just to say that I think that increased effort has been very successful in the 8 initial countries and the ministries of health that received additional support. Over 1 million women had been screened by March 2020 in less than 2 years, and there's been a rapid scale up, and there's a lot being learned from that. And I think it just does demonstrate that with political will and with resources behind it, like scale up can be rapid. And there's a lot, as I said, that's being learned about the need for linkages to treatment through that and many other lessons, but it's learning by doing. And I think that's really important. But I wanted to focus more on the work in Malawi and Mozambique that's actually funded through broader global health, reproductive health resources. And that those projects, they're relatively small, but they're focused on really 2 things. One, how to approach integration of voluntary family planning with cervical cancer screening and preventive treatment. In other words, what works, what doesn't work with integration, how do patients and providers perceive this? Are there benefits in terms of either service, in terms of uptake, and what are the challenges? And the second part, and does community-based screening, is that a good way to go as compared to facility-based screening? And the second part has to do with introducing new high-precision technologies. And what are we learning from that, particularly HPV testing, self-sampling? So what are we learning? First of all, just to say that COVID has definitely had an impact on the implementation of the projects. They've had to pause for 6 months. But despite all that, there's been a lot of perseverance, a lot of energy in them. And we're learning a few things on the integration front. More needs to be done in terms of analyzing the data, completing the studies, but we're seeing a very significant fraction of people that are coming in for one service, either cervical cancer screening or voluntary family planning, are accepting both. We're also seeing that about half of the people who are coming in and using contraceptives, choosing to use contraceptives, are new contraceptive users. That's not clear exactly what all that means yet, but that's a pretty high fraction. And we're also seeing that overall, patients and providers seem to find this very acceptable. And even in the initial site visits and consultations around setting up the projects, there was a lot of excitement around that. Around the new technologies, what we're learning is there's a huge demand for HPV testing, and that's great. The volume is so high, it was higher than we expected, that it does show that with the current kind of platforms we have, it's not necessarily practical to do same-day results with HPV testing. Just because of the volume of demand. So we need to, it's a really good thing, but we need to also figure out the results return, strengthen those referrals. Self-sampling seems to be very well accepted, as others have found, but especially in the time of COVID, it's really helpful. And we're learning a lot about thermal ablation technologies. And as you start to use them, some ways that, just there's a lot that's learned by doing. So I hope that is helpful. Happy to answer any more.
Yeah, no, that's really exciting, and thanks for that. And I want to follow up just a little bit on the funding side, and it's so exciting to see the global momentum around this issue. We've got the WHO Global Elimination Strategy. So we really, I think, feel like there's the wind at our backs. But you did mention it's the political will. and the resources to scale up leads to the rapid success. So it feels like we're getting that political will, but we certainly need to make sure that the resources flow. And having been at USAID before, I can ask this, I know that there's so much appetite to be able to invest in these areas, but that there's been real limitations in how far there is sort of maybe latitude to invest. Do you think that's going to perhaps change a bit? Are there ways for US, and I'm maybe putting you on the spot, but ways that we can really think about how we get the US government more engaged in this? We certainly have administration that is, and a new president that is been champion of cancer moonshot. So is this an opportunity?
Thanks, Wendy. Well, as you know, also being at USAID, I can't really speak on behalf of the agency or the new administration on that time, but from sort of a technical level and sort of the global community, what do I think are some ways the global community can help with really adding momentum to this? And one is just around global goods and, in innovation. And if we look at these targets, and we look at what we're learning about HPV testing, we really need inexpensive point-of-care HPV test. And that's very scalable. That will probably have more impact than so many other innovations, and that's very doable. I'm not gonna go into it now, but if we could fast track that, if we could get it out, because countries see these possibilities, but the costs are very high. So the capital investments required for the HPV testing are high. So we really need to stimulate innovation there. Innovation, global goods of the HPV vaccine around, building off of hopefully some of the excess capacity from COVID and even COVID diagnostics too. And so we need those market shaping, we need those global goods to become more available and the prices to come down. And then I think as, global community, what we can do is help facilitate the process of countries doing sort of a multi-stakeholder collaborative implementation science approach to implementation, where they're in their own contexts working out, because there's so much that needs to be understood about how do you implement these new things effectively? How do you go to scale? And it's context dependent, but countries can work together and learn by doing. And I think the global health community can help stimulate that. The other thing we can do, I think, is demonstrate with our own thinking, collective thinking, the importance of a convergent and integrated approach to health. I saw in the initial slides, there's still a number of donors, that it says some are convinced that integration is important, some are less convinced. And I think hopefully through these efforts, we're going to have more data that shows how to do this smartly, and that not only from the health system perspective, but from the end user perspective, as was mentioned by Samesh, what do clients want? And I think that data, it was very heartening that FP 2020 held a meeting earlier, late last year, on how to integrate better the services, things like the global financing facility for mother and children. I think as the data come in, and global donors can then support countries to just take a broader health systems approach. And the last thing I'll just say, I don't want to take up too much time, is that we have to help people understand that this is a huge public health problem that is almost totally preventable and addressable, and that the magnitude of it, not to compare it to other things directly, but over 300,000 deaths a year, going up maybe 500,000 by 2030 if no action is taken. You compare that to other issues that are so important, like maternal mortality, HIV. It's on the same scale as those, and we have to help people realize that it's important. Thanks.
Yeah, no, I think beautifully stated, and a great call to action for all of us. So I want to get some other voices in here, and also where we've got new funding, and so we've got Nicholas from the Global Fund. So maybe I'm going to turn to you next, and I just say, I think we in the cervical cancer community, we're all very excited by the opening of the Global Fund country planning to include cervical cancer in what's allowable. And so I'd love to hear from you a little more about where you're seeing progress in this effort to encourage integrated approach to HIV and cervical cancer programming, and perhaps you can share some examples of the types of activities that countries are asking to be funded, and maybe options that might be open to countries through the Global Fund in case people are not aware.
Thanks a lot, Wendy. And again, thank you to the organizers and Dr. Similela, Somesh, and Julie for inviting me here. And let me be as brief as possible, but just to piggyback onto what Matt was saying about HIV being a public health problem and the importance of cervical cancer also. And the Global Fund, as a kind of leading institution fighting against HIV and AIDS, it's increasingly important to us, the issue of cervical cancer. Not only because we have now globally almost over 14 million women living with HIV that we are supporting with ARTs, and this longer survival time for these women and the progression to cervical cancer is becoming more and more apparent. We have a very strong commitment to support the screening and treatment of co-infections and comorbidities, including cervical cancer in this cohort of women that are living. And what we've done is since 2015, recognizing this need, we opened up the entry points to countries to actually use their funding requests, to use their allocations to invest in integration. And though it was slow, we've seen almost over the last 2 cycles a threefold increase of investments in cervical cancer. And of course, the kinds of investments are very varied. It goes from actual service delivery integration with comprehensive care for women living with HIV, to even developing policies for cervical cancer and the health system, all the other health systems pieces like training, and on the community side, even demand generation. So it's a very wide array. And as you know, we are kind of led by countries. Our allocations are owned by countries. It belongs to countries. And so it's very important for on the country side to have a lot of leadership in how they invest their Global Fund allocations. And so we have seen huge increases, quite significant increases. But given the need, these levels of investments are basically catalytic. And we've seen, it's an honor to be here with Dr. Sharon speaking, because in 2016, Zambia was the first country really to start using their savings in Global Fund grants that went towards their cervical cancer program. And Zambia is kind of on the forefront, even in our the current cycle, where a significant amount has been put towards cervical cancer screening and secondary prevention. So what did we do? I think I have to say a lot of thanks to WHO, UICC, and UNAIDS for really raising the profile of cervical cancer in the years leading up since the call to action, and then Dr. Nono putting together the strategy. And it was easier in the Global Fund to start amplifying this message through all our access to funding materials, in various guidances to country, where we increase the number of entry points for countries to kind of invest. And the key areas were in the HIV grants and under health systems. And so when we talk about integration, those are the 2 areas that we see a lot of opportunity for investments to increase. One is the health systems piece, where it's a global good for all partners, all donors. We see this in all across the health system, starting from the policy levels, where strategic planning can be integrated, where there are costed plans for cervical cancer and HIV put together, all the way down to the service delivery level, where there's the training laboratory systems that are integrated to support both HPV and HIV and the other disease that we are fighting. So I think I'll stop there for now. But in a brief nutshell, that's what we've done so far. Thanks, Vin.
Excellent. No, it's great. Maybe can I just ask you a little more about, in terms of thinking about coordination of funds between multilateral donors and I know this happens perhaps maybe more on a more opportunistic basis, but are there ways that we could do this in a more concerted manner, and how do we make sure we do it well? And perhaps even thinking about our ways that country teams could be more empowered and given flexibility on the use of funds. So can you dive into that a little bit more?
Yeah, absolutely. Thanks, Wendy. That's a really important question. And so over the last, I would say, 3 to 4 years, there's been an increasing call from donors, funders, countries to actually coordinate across the the financing streams, across programs, etc. We've seen that when we have strong country leadership, very strong country leadership, starting from political will, political support. Zambia is a classic example where there's strong political will, there's strong country leadership. It is almost easier then to bring donors and all the other stakeholders together and plan accordingly and develop a coordinated action plan. But that being said, I think there are opportunities at the global level where we need to coordinate more, and we have opportunities to do that through the various kind of movements towards UHC and primary healthcare strengthening, coordinating across that from across the life course. So from starting from vaccination all the way to tertiary treatment. I think there's a lot of opportunities now, and there's a lot of impetus to do that. At the operational level, our country teams are already trying to do the best at through various platforms. We have our CCMs. The GFF has their country coordinating mechanism. We are working with Gavi and other partners, including United, to actually coordinate well and use the learnings from the implementation research that they've done. So I think there's a lot of coordination going on, but I think we should use the current movements towards UHC and PHC to coordinate even more, so that the complete package of services can be implemented in actually a person and people-centered way. I mean, if we start talking more about the person at the end that we're delivering to, then it would be an important kind of impetus to actually coordinate. And this is where civil society and UICC and the work that they're doing to raise awareness among the people we serve is quite important, because then they know what to demand, and it's driven by that even from ground up. So I think it requires this a very holistic multi-sectoral kind of approach. Thank you.
No, great, thank you. I think it's a nice shift over to Robert, and I'm hearing that we're going to need to move things along because we had to shorten our panel to try to catch up on time. So Robert, first of all, just we're just so grateful for your and expertise, France's support for our Success Project, and you all have been real first movers on the call to action on elimination, and so I really wanted to hear from you. First of all, just thank you for your leadership, but I'd love to hear a little more about the headlines of your strategy that you're taking with technology as a driver to programmatic change and impact. And do you have any early pointers of success in terms of pricing of key technologies? So what are you learning?
Great, thank you, Wendy. Can you hear me? Perfect. Well, first of all, thanks to UICC and JPIGO for co-hosting this webinar, and to Dr. Nono and Somesh for your framing remarks and the earlier speakers. Definitely, United is proud that following the call to action by WHO in 2018, we moved very quickly and approved 2 significant investments totaling around $60 million together. And these investments are being implemented on the one hand by CHAI and partners, as well as Expertise France and JPIGO. And they are working in 14 countries across largely West, Central, and East Africa and Southern Africa, but also Southeast Asia, and one country in Latin America. And in terms of strategy, Wendy, you remember Somesh's 5 Eyes. We're definitely focusing on a number of those and critically innovation. So in the first instance, we are obviously looking to optimize and further ramp up molecular testing. It's a test that exists, it's sensitive, it's specific. But alongside that, we need to look to the future, and that's where we're working on developing artificial intelligence-based screening tools, such as automated visual evaluation, AVE, to detect precancerous lesions in the cervix. It's only by such innovations, and we hope they're ultimately successful, that we can get to a place where you can screen and treat for we hope, $1 or less, which isn't where we are today. In addition to screening and innovations in screening, we want to ensure we can further optimize treatment of precancerous lesions. You've heard mentioned earlier the role of thermal ablation and LEAP devices. So we're looking to pioneer and introduce, and we're already progressing quite well here, handheld point-of-care thermal ablation devices that are much more effective and user-friendly and feasible than cryotherapy. And we're also looking at new and improved delivery models, self-sample collection, mHealth supported patient navigation and follow-up, and so on. And lastly, again, one of the 5 Eyes, national and global advocacy are really key, as well as community engagement and demand generation. So it's a multi-pronged approach, looking at innovations themselves in terms of health products, but also approaches. Important to also say that we're expanding our support to WHO in its enabling capacity to ensure critically that the normative, technical, and research support are there, and they're aligned to the global elimination strategy. And lastly, to your point on progress, I mean, we kicked off these investments in late 2018. They've been running through 2019 with some hiccups this year because of the pandemic, but they go on, and we've had some early successes. We've had important pricing achievements negotiated by Unitaid and CHAI, for example, on thermal ablation point-of-care devices. Huge reductions down to now $850 for a device. That's a 60% price reduction. It still seems high, but that's a big drop. And there was a request in the chat on where is pricing on molecular testing, and the median price is $9, but it does range anywhere between 5 to 10. But some important negotiations have brought down the median price for molecular testing, and we hope that can come down further. And importantly, to Dr. Francois's point in the chat, that we can get that also on point-of-care devices and decentralized devices, so that there's more access in decentralized settings. So these are just some important high-level remarks on the innovations and the types we're supporting across products and approaches, and some of the early successes on affordability on these tools, the new ones being thermal ablation, and we hope there'll be progress with the clinical trials and assessments on AVE, so that screening can become much more decentralized and ubiquitous, we hope.
Perfect. You actually got my follow-up question, and you got some questions from the chat. So really very, very well done. I want to bring Hayat into this conversation and welcome you to the family here. I know the Islamic Development Bank is new to the field of women's cancer, but you were a very, very welcome partner for sure. So, I'd love to, if you could share a little bit more with everybody in terms of your initiative and highlight a bit of what you're focusing on. And I know also just maybe to ask a follow-up question and build that in is you're partnering with IAEA as well. And so perhaps share a little bit more about that and really where you'd like to see all of this go. So over to you, please.
Thanks, Whitney, and thank you very much for the organizers to organize something really, really important. And thank you for inviting me to discuss with you the development of the new exciting program that Islamic Development Bank and the IAEA has partnered together for expansion, for finance, and also access of cancer services for the low and middle income countries. Our program is called Saving Women's Life in Cancer, and it's designed to aid the development of national cervical and breast cancer program. And we are not completely new to this area. I mean, ISDB has been committed for a long time to the global fight against cancer. And now more than ever, with the background of COVID-19, we must not forget issues like cancer. Since 2013, ISDB has approved 164 million in grant and loans of cancer control program in IA member country, including Senegal, Uzbekistan, Niger, Guinea, and Suriname, and Djibouti, and so on. But there is so much to do. So you asked me about the focus, and that's a very important question, because the focus started very simple and very fast from the visionary leader point of view. His Excellency Dr. Ben Al-Hajjar, the President of Islamic Development Bank, he received a report regarding the number of mortality of women and young girls from cervical and breast cancer, and the highest number actually among our member countries. So he called me and he said, we need to save their lives and we need to provide a free treatment for them. So that's the start focus. So we contacted IAEA because they're very well known worldwide for their expertise, international engagement. So selected proposal in terms of the, you may ask me Wendy about the countries. So we selected proposal from the least developed country, like Burkina Faso, Benin, Bangladesh, Azerbaijan, 17 countries. And we did engage with them, with the whole sector regarding cervical and breast cancer, to be able to understand, and also with government, about to determine how much do they need in terms of the technical and financial aids. So through this initiative, and also the other focus, what type of finance should we create? Because this is a huge, as you said, and Princess Nuno mentioned, we should be really eliminate this, you know. So through this initiative, we'll be using a blended finance instrument involving the 5 Ps, which is coined by His Excellency Dr. Ben Al-Hajjar, which is partnership between private sector, public sector, philanthropic organization, and people civil society. The partnership. So according to that, so we establish a fund. We call it Operational Blended Finance Fund. Estimated budget over the 5 years, 500 million. And so far, the current status, we raise about 144.5 million, 80 million and ordinary capital from the ISDB resources for Uzbekistan. IEA put more than like 7.78 million in grant. Also, we have the member country, as the Princess Nono, she was very right to say, you know, the country need to take it as a national really project. So even member country put around 51 million. And we had also member country money from Belgium, France, Morocco, Russia, Sweden, UK, and USA. We had from the private sector, also we have from philanthropic. So the area and the goal of blending finance to be able to encourage and attract support from the private sector, which is very important, to be able to have money, and also to the blended finance will also help them to managing risks, reducing transaction costs, and also increase efficiency. So the operational fund, anybody can contribute either by putting money in a direct fund directly, or have specific projects, or in-kind contribution, including facilities, technical know-how. And also we welcome USAID and global partner to join us in this fund. So our partnership with the IAEA, we need to be creative about the resource mobilization. We need to be innovative about reaching out to community. So hopefully what you said, hopefully but in 5 years, you wanted to see we save about 5 million's life, nearly 1 million from breast cancer and 4 million from cervical cancer. And our partnership include key parts, and anybody can contribute. We wanted to upgrade and establishing cancer care infrastructure, and that's a must, of course. We need to increase the screening for early detection and diagnosis. We need to have increase the capacity of existing facilities, so cancer treatment. And above all, as well, through all this initiative, we need to have quality assurance to make sure that when we help women, we help them in the best way. Thank you, Wendy.
Well, thank you so much, and I think that is so exciting, and I mean this is such a great example of where really big influencers can step up and play such an important role catalyzing funding into this space, and really kind of brings us back to Matt's point early on, when we have the political will and we have the right resources, we can really make tremendous progress. And the other thing that's so exciting that we're hearing from all of you is where innovation can play such an important role, and there are the innovations that are poised to be influential here are ones that can work in low resource settings, and there's a clear role for the private sector to play here in ensuring those are accessible. And I think it's exciting, even as Robert talked about some of the efforts underway to ensure that that those costs are low enough so that we really can ensure access. So it seems
also,
like
Wendy, I just want to mention one thing, if you don't mind. And as exactly what Robert said, and hello, Robert, innovation is a key thing. So a part of all the innovative way of the financial instrument, we set up a call. We're going to set up another call this year, call for innovation for challenging scientists, research centers to come with a new innovative way for diagnostic and treatment and capacity building. And we receive an amazing proposals. And we, of course, we give them a prize, about $50,000 for 4 winners. And we integrate their own idea within the country. And that's way, because we'll be engaging all the time with the innovative ideas. We won't miss what's happening with the front line of innovation and integrate that with our innovative way of blending finance. Thank you.
Fantastic. I mean, I really think where we are going to make progress is as we build up a vibrant, robust ecosystem, and really look for building that sustainable change, and lining up all the key stakeholders in here. I mean, it is the funders, the investors, the private sector, those that can actually build the capacity in country, and that's where it's clear that we are going to all need to be working together in partnership and leveraging resources and innovation and local know-how as best we can. So I would love to keep talking with you all. I know we had a film. I just got a note saying we're going to actually put that film in the chat, I believe. So I don't know if I can interpret this. So maybe Julie, you correct me if I'm wrong. We were going to show them the film, but in the interest of time, we're going to put that in the chat.
Yes, I think if you maybe just invite Anya and Nitya from IAA just to give some perspectives on the partnership as well, that would be great.
Perfect. All right. Well, with that, please.
Over to you then, Anya.
over to you.
Thank you so much. This is really wonderful. And I'm really glad to see this fantastic lineup of so many different partners under the chapeau of the idea of really looking at convergence in a larger scale, which I really believe we need. And, we have the opportunity of a lifetime here to eradicate one cancer, cervical cancer, if we are all come together and really also look at, doing the right things. Here, of course, from the IAA perspective, we are very, very glad to also see the comprehensive approach that Dr. Nono also talked about, and that is exemplified by the 3 pillars that are included in the global elimination strategy, which also now includes access to invasive cancer treatment, which of course is the bread and butter of the IAA, where we have the expertise, where we're providing our resources and also our expertise to all countries. So this is very important that we look at this comprehensively, also from A to Z with all the partners that have already spoken here. But we need also to look at the scale at which we are implementing things. And here, definitely, we need to find ways of increase the scale and really go large and big, and also provide opportunities for national governments and also communities on the ground to access resources in this and expertise. And here, this is of course what Dr. Hyatt has referred to, the idea behind the partnership between the IAA and the ISDB and many others, because we're already joined by many different donor governments, but also the private sector. We have different foundations, and of course, IAA and the Program of Action for Cancer Therapy. We are a joint program also with WHO. So we are very closely working with WHO. We are working with UNFPA and others, discussing with UNITAID as well. So this is actually a mechanism that allows us to bring these things to scale, including the trust fund that Dr. Hyatt referred to, because you need to find a platform where everyone can come together and where we can pool our resources to really make a difference. And the other one is really looking at how we work jointly on innovation. And again, the call for innovation, where also many organizations that are here on the call today, even from the different communities, have participated. So I've actually recognized a number of the names that had put forward proposals also. It's another mechanism that we can of course also use more frequently. This is not a one-off thing, and maybe that's an idea that we can add to the toolkits and whatever we are offering right now jointly, so that we're really pushing ahead on providing mechanisms to really enhance access to resources, expertise in all areas, plus also innovative solutions. So just in a nutshell, from the IAA, we're very excited and definitely look forward to continuing. Thank you.
Yeah, phenomenal. This is all so exciting. I think we have one last person and voice to pull in, and that Heather White, who's Executive Director of Together for Health, I think was just going to say a few words.
Hi, Wendy, and hi, everyone. Thanks so much. And fantastic discussions and very timely discussions. I just have a quick comment, and really, I would say my question has been well answered. It was really about how do we bolster coordination and funding efforts at national, regional, and global levels. And folks have really articulated a lot of those elements well. If I may, I just wanted to let folks on this call know that we at Together are also hosting a webinar tomorrow, January 28th. I'll put the invite in the chat, about global investments, specifically from Gavi and from UNITAID. We'll have Smilka de Lusigny offer details about the global, the UNITAID investments to date and where they see the evolution and how they're catalyzing across their program countries, as well as Anissa Sidibe from Gavi to speak about global investments for HPV vaccine and how they are working to get back online and catch up from COVID disruptions. And if I could just say, we will also from Together share data on a recent report that we've put together looking at global investments. And we recognize that there are quite a few catalytic investments from folks represented on this webinar. And it's great to see, but we're far from where we need to be to really get the 2030 targets lined up in our sites. So I encourage everyone to continue the dialogue around how we can coordinate, share information, share best practices, and impact from innovative tools and technologies more concretely and more as often as possible to simply keep this conversation and these investment dollars flowing. Thank you.
I think that's a perfect way to wrap. We are celebrating all of the optimism and momentum that we have, but we can't let our foot off the gas. We need to keep going and pushing ahead. So with that, let me thank all of our speakers, our panelists today for all of your insights and engagement. And I'm going to hand back to you, Dr. Sharon, to take us through our next segment. Thank you all.
Thank you so much, Wendy. That was a very invigorating discussion, and a lot of things have come out of that discussion. And just a reminder that all the perspectives that you're sharing with us are going to be part of the report of the World Cancer Leaders Summit. So please make sure you continue putting in your comments in the chat box as well. So we have talked on a global level about the various initiatives that are going on to make sure that we are really making cervical cancer as a health convergence. But we also need to look at the national cancer control programs at national level and engaging civil society organizations and local businesses to ensure that there is buy-in, and also that you find that there is uptake of the services that are being offered by the people in the community. If we take a quick example of Zambia, I think it's almost a year, and we started a partnership with support from the Organization of African First Ladies, and there was UICC, Julie came over to Zambia, Roche sponsored part of it, and we brought in the private sector and the civil society, because most of the time, even the local private sector is forgotten. So it gives me great pleasure to bring in the last panel, which is going to be the moderator for this panel is going to be Professor Karen Campbell, who is from the School of Public Health. She's the Director, Cancer Research Division, Cancer Council in Sydney, Australia. Karen not only speaks from experience of leading the elimination charge in Australia, but also as the lead of the modeling consortium, which helped shape the elimination strategy. So we really want to hear from the panelists for the last panel, and continue making your comments in the chat box. Karen, I hand over to you to let us have this interesting panel discussion share with us.
Thank you so much, Sharon, and welcome to our second panel discussion, which is about shaping the enabling environment for cervical cancer elimination. So in doing so, I think it's so important that we maintain focus on all three pillars of the elimination agenda. As we know, and as Dr. Nono so articulately put it, the WHO strategy is ambitious. The goals across the three pillars are ambitious, but we know that it's not just elimination as the end goal that's critical. It's actually about the lives that we can save along the way, the 62 million women's lives that can be saved in LMIC alone over the next century if this can be achieved. And I think, as was also articulated in the last panel, we also have to keep our eye on the fact that although vaccination is the longer term game changer, we have to be relentless about the importance of the screen and treat and the scale up of invasive cancer treatment services, because these will be the enablers of saving lives directly over the next decade or so, and really the way that we will really achieve the Sustainable Development Goals of a 1/3 reduction in premature mortality from cervical cancer by 2030. So the challenges are immense across all three pillars. They're of course exacerbated in the COVID era, but again, we need to maintain our eye on the ball that the cervical cancer burden is actually huge and significant, even in the context of COVID. And in fact, in 2020, represented about 20% of the total global COVID deaths, which of course have received huge exposure. So this is an enormous agenda, and I think it's important that we communicate to communities and to partners about this agenda. So in our first session, we heard really about the role of resourcing and financing issues, as well as touching on the role of innovation. But in this session, we're going to take a deeper dive into some of the other I's in the 5 I's framework. So particularly thinking about integration, information, and influence in this session, as presented by Somesh earlier from his framework. And we really, I think, will be talking about a focus on system level enablers and community enablers. And we saw from the poll presented by Sharon earlier that more than half of you agreed or totally agreed that health programs you're working with are open to or actively building an integrated approach to cervical cancer control. But 40% of respondents indicated there's room for improvement in program design to embrace the convergence principle. So without further ado, I'm delighted to introduce our distinguished panelists today. Firstly, Dr. Innocent Adubi, Director of the National Cancer Control Program at the Ministry of Health in the Ivory Coast. Dr. Patty Gravett, Professor of Global Health at George Washington University in the US. Dr. Clarito Cairo, Director of the National Cancer Control Program, Ministry of Health in the Philippines. and Maud Makwala Sangala, the Executive Director of WOCACA, the Women's Anti-Cancer Association of Malawi. So, Innocent, talking first to you, and I believe you have a few slides, and we thank our French language interpreter, but we're very interested to hear you talk to the situation in the Ivory Coast. Of course, the Ivory Coast is one of the first countries in West Africa to introduce or be in the process of introducing both vaccination and HPV-based screening and treatment. And I know you're also participating in the important Success initiative that we've heard about from Untitled and partners. So we'd ask you, I think, to share headlines on where your plans are and how these first activities will help shape progress towards the 2030 goals and the steps that you're taking towards integration right now. So thank you, Dr. Innocent, over to you.
Merci beaucoup, Monsieur le modérateur. Je voudrais avant tout propos remercier les organisateurs, l'UICC et GHPGO. Je profite pour remercier également Mélanie qui nous appuie au niveau de l'UICC, saluer Madame Fadiga, qui est la présidente des fédérations des ONG de Côte d'Ivoire. Il faut dire que le cancer du col de l'utérus est un véritable problème de santé publique dans notre pays. Il est le deuxième cancer en termes d'incidence, mais il est surtout le cancer le plus mortel chez la femme dans notre pays. Le diagnostic est souvent tardif, mais nous sommes l'un des premiers pays à pouvoir aujourd'hui intégrer dans l'approche la vaccination et le dépistage du traitement, le dépistage par l'HPV et les traitements par cryocoagulation ou encore par thermoablation. Quant aux objectifs en tant que tels, il faut dire que la vaccination est intégrée dans le PEV de routine depuis novembre 2019 grâce à l'appui de Gavi. Et la femme fait par les jeunes filles de 9 ans constituent la cible et nous avons jusqu'au jour d'aujourd'hui près de 33% de couverture en termes de vaccination. Plusieurs projets sont en cours, tels que le projet EMAC et le projet Success sera depuis 2019. Ces projets-là prennent en compte la prévention secondaire avec le dépistage basé sur les tests à HPV et le traitement des lésions précancéreuses par thermoablation. Pour aider à concrétiser cette vision par rapport à l'horizon 2030, il faut savoir que nous essayons d'assurer la disponibilité des vaccins et essayons d'élargir la cible au niveau des jeunes filles de 9 ans à 14 ans. Nous sommes en train de promouvoir les tests HPV dans les services de routine et nous sommes en train donc de voir comment capitaliser tous ces résultats. Mais les choses les plus importantes, c'est d'abord l'intégration. Nous essayons en tout premier lieu d'avoir un engagement politique autour de la lutte contre le cancer du col et le gouvernement de Côte d'Ivoire est très sensibilisé par ce sujet, si bien que nous sommes encadrés et nous sommes dans des préparations de plans stratégiques. Nous essayons aussi de travailler avec d'autres programmes tels que le programme de santé et reproduction et le programme scolaire pour pouvoir avoir le maximum d'impact. La société civile est également impliquée pour la mobilisation. C'est ainsi que nous avons une fédération des ONG de lutte contre le cancer et cela sous l'impulsion
Thank you so much, Dr. Innocent. That's fantastic. So I think for those that hopefully you will manage to access the English language channel for English speakers, but I think you've eloquently spoken there to the importance of mobilizing a range of stakeholders, including civil society. So I'd like to really pick up on this and turn to Patty Gravett. Patty, in your work with partners in Peru, what challenges have you come across in operationalizing your plans? And have you found any solutions that others could benefit from? And I guess picking up on this importance of engaging civil society and community, are there learnings that you have from your experience for other countries?
Sure, yeah, I'm happy to speak to that. I think a lot of what I'm hearing has been very much consistent with our experience. And that's sometimes, you know, one thing that we have to remember about cervical cancer screening in particular is that it is a complex intervention and it has multiple layers that need to be involved across the health system. And that's somewhat true with vaccination as well. And particularly when we're trying to integrate HPV vaccination, cervical cancer screening and treatment with other health initiatives and health programs. One of the things that's important to realize is sometimes people who are operating the system don't always have the same idea about how the system's operating, and therefore where the most important levers are to pull and the ones that they could integrate with high efficiency. And so what I would say is that, you know, something that I've just written down is I think we do need to act quickly on the elimination goals in terms of making a commitment to move, but we need to implement deliberatively. And so what I mean by implementing deliberatively is we need to form implementation teams and partners across the different units of implementation in the health sector, which allows each of these perspectives we've been talking about, the private sector, all levels of the healthcare delivery, the recipient of the services, to come in and show their perspective and voice in the beginning of implementation planning, and to make those decisions very visible to each other so that we can enable ourselves to talk together towards a shared goal. I think having the 90, 70, 90 elimination goals is a perfect way to initiate these conversations because it makes a clear target. And I think that if we can create that shared understanding and shared visualization with collective discussion and dialogue towards decision-making on how we implement, then that's a really important strategy. I think the second thing that we found is that there does need to be opportunity for localized adaptation. And sometimes doing scenario analyses with the stakeholders to really think through, you know, what I've often said is there is no right way to implement vaccination programs, and there is no right way or best way to implement screening programs. There is a best way for the context, for your situation and your health system. And what people want to do in the adaptation process is to understand, well, what is the right way for me? And that acknowledges what are your unique constraints and enablers, and then how do you take the tremendous toolbox of innovations that we are fortunate enough to have in cervical cancer prevention and employ them or deploy them within your system so that you can move towards meeting your goals. So I think those are two high-level starting points in terms of just the implementation planning to make sure that you start yourself off on a really solid footing.
Mm-hmm. Thank you very much, Patty. I mean, would you be able to perhaps speak in a little more detail with an example? I mean, I think, for example, if we take the screening pillar of elimination, you know, I think the challenges there are really around how do we deliver HPV testing, because that is the current option. Is it point of care? Is it self-collection or both in settings? Do countries have mixed models of delivering HPV screening? Do they do triaging and so on and so forth? So how have you dealt with those challenges of tailoring something very specific like the pathway for screen and treat in a country to the needs and to the opportunities?
Right. So what we've done is we've really, you know, there are two steps, I think. One is to start off with what you think the best strategy might be for your situation. We've been working in a kind of a mixed environment context in Iquitos, Peru. So one of the interesting things about Iquitos is it's an entire department of Loreto in Peru, which is only accessible by plane or by boat. So that creates a lot of supply chain challenges, for example, and getting things in and out, and that's particularly been affected by COVID. But even within that environment, you still have cities. Iquitos is a very typical kind of city with primary health centers, and then you have much more inaccessible and remote areas that serve smaller populations. So one of the things that we have, and this is something that by taking this deliberative implementation planning approach, with the stakeholders who are actually involved in the service delivery themselves being really key partners and looking and evaluating at how things are moving forward and how and what's working and what's not, they've realized that what they should do is, for example, where the population size of screen eligible women is 500 or more within a health facility, then it's a good idea to have the services available to them within the health facility and integrate it within their routine delivery. But in places with smaller and much more remote populations, you know, if you're screening with HPV once every 5 years, you could just have a rotating campaign strategy to go to each of these villages once every 5 years. And that organization then becomes something that is not, you know, it's not too difficult. I think one of the things that we found to be really helpful was to help people look at the real numbers we were talking about. So if you're screening a population of 20,000 in one health network, that doesn't mean you need a capacity to screen 20,000 today. It means you need the capacity to deliver these services over a 5-year period. And, you know, with that, you can start to see that the number of women you need to actually manage and treat per month becomes something much more tangible and acceptable. So bringing things down from the millions level to what they are actually seeing has been really helpful.
Thank you so much. That's very sage advice. So before we go on, I'd just like to let you know that I've just received a message that we're planning to extend the session for 15 minutes. So I do hope that you can all stay on to benefit from this incredible discussion. So we might move now to the policy level. And Clarito, I think we'd be very interested to hear from you about what's been done in the Philippines. Of course, the Philippines has introduced the National Integrated Cancer Control Act, aiming to strengthen cancer control in the country and reducing burden on families and survivors. And it's such a progressive approach to cancer control and to securing high-level policy support. So, Clarito, could you please start by briefly describing the Cancer Control Act for those that don't know about it, and also perhaps tell us how you hope this will facilitate the rapid adoption of the cervical cancer elimination agenda in the Philippines? Clarito.
Yes, thank you, Karen. So the National Integrated Cancer Control Act, or the Cancer Law, aims to address the cancer as a public health burden in the country. Since 2016, it has been the second leading cause of mortality among the Filipinos. And cervical cancer is the second leading cause of mortality, cancer-related, among our Filipino women. So there's really a marching order to address cervical cancer. And thankfully, we have this global strategy to accelerate the cervical cancer elimination. So with regards to the relationship between the law, the cancer law, and the global strategy, there's a huge, what do you call that? We can fast track, okay, the elimination of, or the management of cervical cancer, particularly from prevention and control, because with the cancer law, we can now prioritize cancer, including cervical cancer, and we can increase the budget. And that's very important for us because before the law, the budget for the cancer control program is very low. And now that we have the law since 2019, our budget increased dramatically starting this year. Okay, so only this year, 2021, while we have this pandemic. And again, another breakthrough is that we were chosen, the Philippines, as one of the 4 countries with Cote d'Ivoire, Burkina Faso, and Guatemala as the pilot sites of the SUCCESS project. So SUCCESS stands for Scale Up Cervical Cancer Elimination with Secondary Prevention Strategy. So all efforts are now geared towards the prevention control of cervical cancer and ultimately elimination of cervical cancer.
Well, that's absolutely fantastic news. And I think what you've spoken to there is really that you have succeeded in addressing some of the key barriers to implementation, particularly in-country financing. That speaks to sustainability. I guess on the flip side, though, I'm sure there are many remaining challenges for you in the Philippines. So what challenges are in terms of getting to the 90-70-90 targets by 2030? What are the current challenges? And also perhaps you could speak a little to what support you think you need from the global community to get.
Yeah, as of now, our primary or number one challenge would be the ongoing COVID-19 pandemic, which contributed to the restrictions of services for our patients with cancer, including cervical cancer. And hopefully, the implementation of our success project would not be delayed or greatly affected because of this pandemic. And the 90-70-90 targets will still be followed by the Philippines. And of course, the 5 Eyes framework, I like that, as mentioned by Dr. Kumar. And thankfully, it's being followed also by success. So we can now fast track the approval of the success because right now it's still being, still pending because of the bureaucracy. All efforts are focused on COVID-19 pandemic, but if not this week, next week, we will fast track the approval of the success project to be implemented in the country. And rest assured that it will be prioritized in terms of financial and let's say it will be one of the priorities, the top priorities of the cancer control program.
Thank you. And I think it's so important to remind ourselves that the 2030 targets were designed as 10-year goals. So a delay of a year, 2 years, 3 years even, because of the pandemic should not mean that they are necessarily unachievable. So thank you very much. I'll just remind all participants to keep themselves on mute. We've got a bit of breakthrough noise coming through. So thank you so much, Clarito. So I'll turn now to Maud. Maud, while we're talking about system level levers as we are, I think we'd be really interested to hear from you about the situation in Malawi. Have you got an example for us about what you think might need to change in Malawi to really achieve the elimination goals and to see scale up of services? And I guess in thinking about this and in hearing your perspective, we'd love to hear how you and your organization and how civil society in general has played a role in Malawi, and how did you find that partnership playing out? So over to you, Maud.
Thank you, Karen. Hello, everyone. Just like to thank the speakers who have gone before me, who have spoken. I'd just like to explain our organization. We are actually in the rural areas, actually mostly hard to reach areas in the country. So most of the screening which we do, because mostly we do screening campaigns, we do them in the rural areas. So the most thing we'd like to see being scaled up in these places is information which goes to the rural population. There's so many misconceptions, so much myths which go around, which are actually a barrier for women to get screened. So information is very important. So with our collaborative partners, we usually have campaigns where we go into these places and we speak to the population, not only women, we actually involve the whole population, the communities, the chiefs, the health surveillance assistants, religious leaders, so that they understand what we're talking about altogether. They should understand the 90-70-90 targets. So we do that with the communities and then we explain it to them. Then after all that information is shared, we'd love to push them to health facilities where they can actually get screened and treated. The problem we have is that the biggest barrier is distance. And I think that's where I think Patty has talked about where we should have something which is community-based, where help should actually go to the communities. Because if a woman gets all this information about screening and then she has to walk 30 kilometers, it doesn't make sense to her. She's not sick, she doesn't have a problem. So the only time she goes to the hospital is when she starts presenting something where there are symptoms coming out. And that's not what we want to happen. So I think the biggest thing is what we like to do to scale up is there should be enough information going there. There should be investments which should be made, especially when it comes to communities. Let's have these rotational screenings on HPV, DNA, whatever, in the communities themselves, because that would really help them. As I said, distance is something to them. When they're not sick, they will not be able to go to the hospital. They'll only go to the hospital when they have a problem. Another thing we have is that when we're doing the screenings in the health facilities, we've actually taken advantage of other platforms which are already there, which is integrated services. Like we use the under 5 clinics, we use the circumcision clubs, we use the ART clinics, which are very helpful. We get a lot of people from those kind of services, which actually opt to now go and maybe advise their wives. Like if it comes to the people in circumcision, they're able to tell their wives if they could come in for screening. Under 5 family planning, there are also people like joining, and they're actually able to also go and have themselves screened. So the integrated part is also very, very good when it comes to the health facilities themselves. Collaborations are, I think, one of the things we should actually do, because we are working closely with the government. We're able to get this partnership with them where they actually refer us to places where they're getting late cases, and we're able to go into those areas and do our campaigns. And as we said, we send them to health facilities. So those collaborations are important, but also collaborations amongst ourselves as CSOs are so important, because at times when you're going to these places, we tend to send different messages to the communities. So for us to get things done, to get that 70% screened, it is important that the language we speak as CSOs should be one. So it's very important for us to have collaboration amongst ourselves. I just want to talk a bit on the HPV vaccine, which was rolled out in Malawi since 2019. The acceptance rate was very good, and it's been very good up to now. From this, it was the parents who made constant for the children to have this vaccine. So we have that population of women or parents who already know about cervical cancer, which we have to take advantage of. They already know they have accepted their children to be vaccinated. That means them as well, the women should actually go for screening. And if there's anything they find, they should be treated. So mostly that's how we've been working in these areas. We go into very remote, hard to reach areas. Right now, it's very hard to get into these areas because it's rainy season like in Malawi. So most of the places you're talking about 30 kilometers, it's actually a mud road. To get into those places, it's very difficult. So you can imagine a woman making a decision to just have herself checked in that point in time, in that kind of season, it's very difficult. So we want services to be pushed. They should be at health facility, but also community-based, to make sure that we take advantage of those women to be screened, treated, and if there's invasive cancer, they should be pushed to the main hospitals.
Thank you so much. I think that's really cogent and a reminder of the need to involve the communities themselves in this from the beginning. So actually, I can see a couple of related comments and questions coming through the chat. I mean, perhaps I'll ask Sharon to comment on the Zambia perspective. Sharon, I mean, can you comment on how you've succeeded in this aspect, community mobilization in your setting?
Thank you so much for that, Karen. And I was just actually putting in the chat one of the interventions that we started some years back called village-based screening. And this is through the traditional leaders, because we noted, like Modi has mentioned, the issue of distances for the women, especially in the rural area, coming through. So what happens is that you map up, we've got like 288 chiefdoms, and you map out these chiefdoms and ensure that you start from the chief themselves and the headmen, and we've had chiefs as well, and what we call indunas, who are like the headmen, key henchmen, and talking to them about reproductive health, including cervical cancer, together with people. And when the chiefs understand, then you spend a week of mobilizing in the village, and then the actual screening starts after about a week when the people in that village have understood. So you spend 10 days. The first week is community mobilization, information sharing, letting go of their fears and letting them understand why it's important, and letting even the chiefs or the counselors or the headmen also get involved. By the time you're reaching the week of screening, you have gained so much ground. I think in 1 year, we did screen over 10,000 women in these villages who came. And we also make sure that it's near a health facility where we are screening, so that we can be able to give the services. And if we have to make sure that they need further treatment, the channel is already initiated. And you don't bring the nurses from the capital to go and do the work alone. You make sure that the nearest clinic, which is screening, is the one that is leading this initiative, so that even should they have problems in the future, they know where to go, and they know the people in their communities who are doing the screening. Amazing. Together with the religious leaders, you have to take the same concept of going to the ground and first teaching the people who are the leaders, the voice of reason that are in those rural communities, in the urban communities. And you find that it goes. Social media has been used massively in Zambia. We have a platform where we have close to 150,000 women, some not only from Zambia, and we get experts also to share information, and they share their screening status. When they go for screening, they show their cards. And this is one of the ways that we have engaged civil society. So there's modern, there's traditional, just use the social cultural channels that are available in your countries.
Thank you so much. And I think all our panelists are giving really a consistent message there about community involvement. Sadly, this panel will have to draw to a close, but before we do, I just also wanted to touch on another very important issue that's been raised in the chat, the importance of one of the I's, information. And I think, Patty, a question for you, the importance of integrated data management systems here. How do we enumerate adolescents and women for vaccination and screening? How do we ensure that we are not losing efficacy by losing women to follow up, or by being unable to recall women as needed for treatment? This is such an important priority in establishing effective screen and treat pathways. Would you like perhaps to comment on this, Patty?
Sure. Yeah, I think this is one of the most, if you were thinking of levers small and large, I think pulling the lever on really adaptable and flexible data management systems that can integrate across different programs, not just cervical cancer screening, is one of the biggest levers you can pull, because for a variety of reasons. I think one is we want to be able to track and manage patients so we can ensure that they've received whatever continuum of care and that we are meeting our goals. I think the other thing is that, one of the best ways to ensure sustainability of a program is to continuously look back at whether, you're meeting your goals. So for example, in Peru, we look at how many women we're screening and treating per month against a monthly goal, right? If we want to screen 20,000 women over 5 years, we need to screen 233 per month over those 5 years. And so we track and monitor that. And it's that feedback of those auditing data to the health centers of how they're doing. And then an engaged dialogue to say, well, what's happening here? Is something going wrong? Can we change something? Is something in our original plan not working? And we need to modify it. So having that ability not only to track and manage patients, but to look back and learn and adapt your plans to new realities like a coronavirus pandemic. It's really, really important. And one of the things that we've recognized is that existing information systems, for one, are not very patient oriented. They're very directed towards aggregate statistics, so that they're not very helpful to the people who are really on the ground managing patients. And the other is that every health program has set up their own management, system, and so then it's very difficult to integrate those across different levels of care. So I do think we have to be cognizant that not every situation has the capabilities of, for example, highly effective mobile technologies, depending on their cellular coverage. And so some hybrid models may be necessary, but really looking at how we can look at the system and the capabilities and really develop these, and giving support to the people on the ground to do that, helping them to understand how to use the data for themselves to continuously improve their program will be essential for sustainability and scale up.
Right, and I think that's back to that message about needing to customize to the local environment, even though, of course, we're so excited about some of the potential wins that we're seeing in the e-health space around setting up screening and vaccination registries. And I think particularly we've all kept such a close eye on Project and our program Rose in Malaysia, which has been so successful in that space. So I'm told we actually do have a few more minutes, which is wonderful. So I'd like to ask Innocent or Clarito, would you like to comment on the issues that we've just been discussing? Firstly, community engagement and data systems. I'll open it up to Innocent first to comment on either or both of those aspects. Thank you.
C'est une donnée très importante. Ici en Côte d'Ivoire, nous avons un registre du cancer du col de l'utérus depuis 2 ans, donc qui collecte les données. Et par rapport au dépistage, il faut dire que nous avons pu initier la mise en place de 130 sites dans tout le pays où nous faisons l'inspection visuelle à l'acide acétique, et au départ avec des traitements par cryothérapie. Et grâce au projet Success, nous allons maintenant engager les tests HPV et la possibilité donc de la thermoablation. À ce jour, nous avons dépisté en Côte d'Ivoire autour de 150 000 femmes depuis 2009 jusqu'à ce jour. Donc, les choses vont bien, mais il faut effectivement intégrer la communauté, et c'est ce que nous faisons avec les leaders de communauté, les leaders religieux, qui sont tout à fait partants dans cette stratégie d'approche. Merci.
Thank you very much. Very important at both levels. So, Clarito, would you like to comment from the Philippines perspective?
Yeah. So, since I think 10 years ago, we've been using VIA, visual inspection of the cervix, using acetic acid as the primary tool for cervical cancer screening. And with the global strategy to accelerate cervical cancer elimination, we need to step up and step out. So we're going to use HPV DNA testing together with the gold standard, Pap smear. And of course, we need to provide treatment for the precancerous lesions at the community level. And then we have this referral network where the providers are seamless, okay? So if there's a need to refer the patient to the level 3 or tertiary hospital, then there should be no barrier. And for the data management, it's really important. That's why we have this Philippine Cancer Registry in the law, in the cancer law, and it will be the central repository of our data, of all our cancer data, and all hospitals are now required to report all cancer data. We call now cancer as a notifiable disease starting last year. So yeah, thank you.
Thank you very much. And I really like your expression, step up and step out from VIA to HPV screening. Of course, that's one of the big challenges for countries.
Thank you.
And on that note, I am sad to say we must draw this panel to a close, but I'd really like to thank all our panelists for such an engaging and important discussion, and wish you well in the driving initiatives in your own countries, and thank you for your contribution to the global agenda. So with that, I will hand back to Sharon. Thank you very much, Sharon.
Thanks, Karen. This has been an amazing time. I'm sure everybody has learned quite a lot from the various discussions. And, you know, it's always important to see how what looks like a problem in your setting could have a solution in another country, and to learn from each other and see how best we can be able to use what we're learning from others. I sincerely want to thank you, Karen, and the other esteemed panelists who've done an amazing job explaining from the global level, coming down to the community level. That has been totally amazing. And what I really see is that there's so much enthusiasm from across, from the people, the attendees, and from the panelists to be able to exchange various information. But it also does show that we have a long way to go for us to be able to achieve the 2030 agenda, as far as ensuring that we make cervical cancer elimination a facilitator for health convergence. Very important. So and to sum up this wonderful discussion, I really want to call upon Dr. Leslie Mancuso from JPIGO. She is the president and chief executive of JPIGO, to really share impressions. And maybe she's going to speak her mind and to give us the summary, the closing of such an amazing discussion that we have had this afternoon. Over to you, Leslie, for the closing remarks. Thank you, everybody.
Well, thank you so much, Sharon. First, let me congratulate UICC and all the partners and all the panelists today. Truly extraordinary sessions. As Sharon indicated, I'm Dr. Leslie Mancuso, the president and CEO of JPIGO, and it's my honor to be part of this event that's highlighting a topic that's been central to the mission of JPIGO for the last 25 years, and that's saving women's lives from cervical cancer. Now, we all set up today during Cervical Cancer Awareness Week so that we could discuss how we can drive towards the global agenda and strategy that we have in order to eliminate a preventable and treatable disease. As many of us know that have been working with the most vulnerable communities in the world, we have seen needless maternal deaths due to lack of access to healthcare. And like that, the truth be told about this disease, we know that even though we have all the tools, the poorest women who lack access to healthcare are often those that lose their lives. You all know the statistics better than I. 750 women are still dying each day, 266,000 women a year. And the majority of these women, 85%, are in the developing world. But the good news is we are changing this tide. And if you didn't believe it before, you would believe it today after these panelists. All that's missing now is what we've heard today, this commitment, this passion, this goal of all of ours to work together with all that we know and all that still needs to be discovered to move our platform along to eliminating this. You know, in November, at the launch of the WHO strategy to accelerate the elimination of cervical cancer, it really did rejuvenate and also inspired us to realize we have a lot to do. But we also know that we know a lot about cervical cancer, certainly more than most cancers around the world. As you've heard today, we have screening and treating programs. We have HPV testing. We have thermal ablation. We have HPV vaccinations. And we have AI, new strategy tools that'll be looking at visual examinations, automated visual examinations, all of these helping us to increase equitable coverage moving towards the 2030 90-70-90 goals. We know now that women can be screened in their own homes or in a clinic close to them by self-collection. We also know that we can treat precancerous lesions using a variety of techniques, but certainly at the lowest levels of health centers. It also reminded us today that women are not dying because we don't have all the strategies. They're dying because these strategies are not reaching the women that need it most. As we face challenges over this last year with COVID, not only COVID, but the disruption of oncology services, what we've certainly seen is our need for all of us, as we've heard today, funders, government leaders, INGOs, global agencies, and the like, all of us working together so that we don't lose the progress we've made today. There is no doubt that the importance of collaboration and coordination between all of us is critical, and we saw that in the panelists. What also is critical is the collaboration and coordination of funders to scale in particular. Not only is this possible, but it's going to be necessary if we're going to eliminate cervical cancer. Now, no doubt Jhpiego has been fortunate to work with so many of you in this space, but I was very happy today to hear about the first panelists as they talked about convergent programming and the need for more innovative technology and the need for more process and new solutions in policy that'll help us address the needs of the client. No doubt that route is going to help us escalate access to cervical cancer services for all women. It was also encouraging to hear about cervical cancer funding that's now available within different donors. No doubt that we should all be excited and applaud the Global Fund for adding cervical cancer funding to their programming. We should also laud PEPFAR for adding cervical cancer funding to their programming. And certainly Unitaid, that has been out in front, proactively encouraging the development of new technologies and encouraging integration of services to be used as levers so that we can accelerate our goals in reaching our 2030 strategies. So today we also heard about critical points that we need to do to bolster an enabling environment in the health system in order to accelerate cervical cancer elimination. We also learned about the community and the need for community engagement and the challenges because there's so many priorities confronting these communities. But what we heard were countries and governments making commitments to multi-year funding so that we can in fact reach the 2030 90-70-90 goals. No doubt, Jhpiego, and I know many of you, stand ready to work together so that we can not only invest in the clinical and the technical domain, but also invest in building the capabilities of the market solutions like market shaping. Also, commitment to coordinating and looking at new models for working with the private sector, and also looking at investing in financial solutions that'll help us leapfrog and get and move off of where we are to accelerating and moving to eliminate cervical cancer. There's no doubt Somesh's points about the 5I framework. I think that simplistic framework, if you will help us not only, as Somesh said, not only with primary prevention, but certainly I could see us using that with secondary prevention and treatment as we move along. Let me remind you, it's a multidimensional effort that they speak about in the journal. They talk about innovation, integration, information, investments, and influence that will dramatically help us expand access for all women. So in closing, let me just say, I want to thank everyone for this engaging discussion. It's inspiring to hear so many people working together and understanding that it's our ultimate goal to eliminate cervical cancer, and we can do this. No doubt we have a new strategy. No doubt we have renewed hope. No doubt that as a collaborative group, we can come together. Together, we can eliminate cervical cancer. Together, we can make sure that women thrive. Together, we can make sure that communities thrive, because we know when there are healthy women, there are healthy families, and when there are healthy families, there are healthy communities. So let us all join together and work towards our end goal of eliminating cervical cancer. Thank you, everyone.
Thank you so much, Leslie. That was a very rousing end. I'm sure we've all been very inspired to go back to our desks and be bold in our next planning steps. So thank you, everyone. It's been a long afternoon, but I think from the chat and exchange, we've seen that it's been very rewarding for you all, and we look forward to you joining our next dialogue with information about that coming soon. Thank you very much. Goodbye.
Goodbye. Thank you.
Bye.
Bye-bye.
Bye.
Thank you. Bye. Thank you, everyone.